Question 1. What is the primary purpose of the Health Insurance Portability and Accountability Act, HIPAA? A. To regulate medical billing codes. B. To protect patient privacy and limit access to health information. C. To set standards for medical equipment manufacturing. D. To provide guidelines for physician licensing. Answer: B. To protect patient privacy and limit access to health information. The key terms here are primary purpose and HIPAA, which stands for the Health Insurance Portability and Accountability Act. This important law establishes national standards to protect individuals' medical records and other personal health information, known as Protected Health Information, PHI. It ensures that PHI is handled securely and confidentially by healthcare providers, insurance companies, and other entities that come into contact with it. For example, a medical assistant cannot casually share a patient's diagnosis with a friend, even if they work in the same clinic, without proper authorization. Think of HIPAA as the rulebook for keeping patient information private and secure. Question 2. When scheduling an appointment, what information is crucial to obtain from the patient? A. Their preferred method of payment. B. Their social security number. C. Their date of birth and phone number. D. Their primary care physician's name. Answer: C. Their date of birth and phone number. When scheduling an appointment, the crucial information needed to accurately identify and contact the patient is their date of birth and phone number. While payment information and doctor names are important for other administrative tasks, the date of birth serves as a unique identifier for patients, and a phone number is essential for confirming appointments or contacting them if there are changes. For instance, confirming an appointment with John Smith would be difficult without knowing which John Smith it is. The date of birth clarifies this. So, always get the basics to ensure you're scheduling for the correct person and can reach them easily. Question 3. Which of the following is an example of an emergent medical situation requiring immediate attention? A. A mild headache. B. A minor cut that stops bleeding. C. Sudden chest pain and shortness of breath. D. A routine follow-up appointment. Answer: C. Sudden chest pain and shortness of breath. This question tests your understanding of medical emergencies. The keywords emergent medical situation and immediate attention point to a life-threatening condition. Chest pain and shortness of breath are classic symptoms that can indicate serious heart or lung problems requiring urgent medical care. A mild headache or a minor cut are generally not emergencies, and a routine follow-up is a pre-scheduled visit. For example, if a patient calls saying they are experiencing severe chest pain, it's a red flag to act fast and get them to an emergency room. Always remember that severe symptoms like chest pain or difficulty breathing are top priorities. Question 4. What is the purpose of a medical release form? A. To document patient allergies. B. To authorize the disclosure of patient information. C. To schedule follow-up appointments. D. To collect insurance copayments. Answer: B. To authorize the disclosure of patient information. A medical release form, also known as an authorization for release of information, is a legal document that grants permission for protected health information, PHI, to be shared with a specific individual or entity. The keywords purpose and medical release form highlight its function in patient privacy management. Without a signed release, sharing patient information is a violation of HIPAA. For instance, if a patient wants their medical records sent to a specialist, they must sign a release form specifically naming the specialist's office. Think of it as a patient's written consent for their medical details to be shared. Question 5. What is the most appropriate way to greet a patient arriving for their appointment? A. Are you Mr./Ms.? Last name? B. Who are you here to see? C. Hi, how can I help you? D. May I have your name and date of birth, please? Answer: D. May I have your name and date of birth, please? This question focuses on patient reception and identification. The keywords most appropriate way to greet and arriving for their appointment emphasize professionalism and accuracy. Asking for the patient's name and date of birth is the standard and most effective way to verify their identity and locate their appointment in the system. Other greetings might be less direct or could lead to confusion. For example, simply asking, "Who are you here to see?" might not directly identify the patient if they haven't stated their purpose yet. Always start by confirming identity professionally. Question 6. When handling a patient's copayment, what is the standard procedure? A. Waive the copayment if the patient seems distressed. B. Accept payment in cash only. C. Inform the patient of the amount due and collect it at the time of service. D. Bill the patient for the copayment after the appointment. Answer: C. Inform the patient of the amount due and collect it at the time of service. This question tests knowledge of basic financial procedures in a medical office. The keywords handling a patient's copayment and standard procedure highlight the expected process for collecting patient responsibility. Copayments are typically due at the time of service, and the administrative medical assistant should inform the patient of the amount owed. Accepting various forms of payment is common, not just cash, and waiving payments or billing later are not standard practices unless specific arrangements are made. For instance, you tell the patient, "Your copayment today is $25, and then take their payment. It's crucial to collect these fees upfront to manage the clinic's cash flow. Question 7. Which document provides a chronological record of a patient's medical history, diagnoses, treatments, and test results? A. The patient's insurance card. B. The encounter form. C. The patient's medical chart or electronic health record, EHR. D. The appointment schedule. Answer: C. The patient's medical chart or electronic health record, EHR. This question is about medical documentation. The keywords chronological record, medical history, diagnoses, and treatments are all key indicators of a patient's medical chart or electronic health record, EHR. An EHR is a digital version of a patient's paper chart, containing comprehensive medical information. An insurance card is for billing, an encounter form summarizes a visit for billing, and an appointment schedule tracks visits. For example, when a new doctor needs to understand a patient's past health, they review their EHR. This is the central repository for all patient health information. Question 8. What does triage in a medical setting refer to? A. Prescribing medication for a patient. B. Organizing and prioritizing patients based on the severity of their condition. C. Performing diagnostic tests. D. Performing surgery. Answer: B. Organizing and prioritizing patients based on the severity of their condition. Triage is a critical concept in healthcare, particularly in emergency settings. The keywords triage and prioritizing patients based on severity define its core function. It involves quickly assessing patients to determine who needs immediate care and who can wait, ensuring that those with the most critical conditions are seen first. This process helps manage patient flow efficiently and save lives. For instance, in an emergency room, a patient with a heart attack would be triaged to be seen before someone with a sprained ankle. So, triage is all about sorting patients by how sick they are. Question 9. When communicating with a patient over the phone, what is important to maintain? A. Casual conversation to build rapport. B. A professional tone and clear speech. C. Minimal interaction to save time. D. Loud and fast speech to ensure they hear. Answer B. A professional tone and clear speech. Effective communication is vital in healthcare. The keywords communicating with a patient over the phone and important to maintain highlight the need for professionalism. A professional tone and clear speech ensure that the patient feels respected, understands the information being conveyed, and can easily communicate their needs. Casual conversation, minimal interaction, or speaking too fast can lead to misunderstandings or make the patient feel undervalued. For example, speaking clearly and at a moderate pace when explaining appointment times helps prevent confusion. Always aim for clarity and professionalism in phone conversations. Question 10. What is the primary role of an administrative medical assistant in a physician's office? A. Diagnosing illnesses. B. Performing surgical procedures. C. Managing administrative and clerical tasks. D. Administering medications. Answer C. Managing administrative and clerical tasks. This question asks about the primary function of an administrative medical assistant. The keywords primary role and administrative and clerical tasks clearly define the scope of this position. While medical assistants can have clinical duties, the administrative role focuses on non-clinical operations like scheduling, billing, record-keeping, and patient communication. Diagnosing illnesses, performing surgery, and administering medications are typically the responsibilities of physicians or other licensed clinical professionals. For example, booking appointments or processing insurance claims falls under administrative duties. Remember, your main job is to keep the office running smoothly behind the scenes. Question 11. What is the correct procedure for handling returned mail for a patient? A. Discard the mail immediately. B. Forward the mail to the patient's previous address. C. Attempt to verify the patient's updated contact information and update the record. D. Return the mail to the sender without any action. Answer C. Attempt to verify the patient's updated contact information and update the record. Handling returned mail requires attention to detail and a proactive approach to maintaining accurate patient records. The keywords returned mail and correct procedure point to the need for data integrity. It's essential to try and confirm the patient's current address to ensure future communications reach them and to update their file accordingly. Discarding it, forwarding it blindly, or simply returning it without updating the system can lead to lost communication and outdated patient information. For instance, if a bill is returned, you'd call the patient to confirm their address before remailing it. Keeping patient contact information current is key to good practice. Question 12. What does informed consent mean in healthcare? A. The patient agrees to treatment without understanding the risks. B. The patient receives and understands information about a proposed treatment, including risks and benefits, and agrees to it. C. The healthcare provider decides the treatment for the patient. D. The patient agrees to treatment based on another patient's recommendation. Answer B. The patient receives and understands information about a proposed treatment, including risks and benefits, and agrees to it. Informed consent is a fundamental ethical and legal principle in healthcare. The keywords informed consent and understands information, risks and benefits, and agrees to it define its core components. Patients have the right to be fully informed about their medical options, including potential side effects or alternatives, before they agree to any procedure or treatment. This ensures patient autonomy. For example, before a minor surgery, the doctor explains what will happen, what the pain might be like, and what the outcome could be, and the patient then signs a form agreeing. So, informed consent is about patient knowledge and voluntary agreement. Question 13. When is it appropriate to use a patient's medical record for research purposes? A. Never, without explicit written consent. B. Only if the research is approved by the clinic manager. C. After the patient has been deceased for 5 years. D. Anytime, as it is a de-identified dataset. Answer. A. Never, without explicit written consent. This question addresses patient privacy and research ethics, especially concerning HIPAA. The keywords research purposes and explicit written consent are crucial. Patient health information is highly sensitive, and using it for research, even if de-identified or approved by management, requires specific authorization from the patient. This protects their privacy and autonomy. For instance, if a researcher wants to study treatment outcomes for a specific condition, they must get permission from patients to use their anonymized data. Always remember that patient consent is paramount when their information is used for anything beyond their direct care. Question 14. What is the most common method for scheduling a series of appointments over several weeks or months? A. Open office hours. B. Wave scheduling. C. Cluster scheduling. D. Advanced scheduling. Answer. D. Advanced scheduling. When a patient needs multiple appointments spread out over a longer period, like for physical therapy or a chronic condition, advanced scheduling is the most logical and efficient method. The keywords series of appointments and several weeks or months indicate a need to book future dates proactively. Open office hours are walk-in, wave scheduling brings multiple patients in at once, and cluster scheduling groups similar appointments. Advanced scheduling allows for proper planning and ensures the patient secures their future slots. For example, scheduling weekly therapy sessions for the next 3 months is a clear case of advanced scheduling. Booking ahead ensures continuity of care. Question 15. What is the purpose of a superbill or encounter form? A. To provide a summary of the patient's medication list. B. To document the services provided to a patient during a visit for billing purposes. C. To schedule the patient's next appointment. D. To record patient demographic information. Answer. B. To document the services provided to a patient during a visit for billing purposes. The encounter form, often called a superbill, is a critical document for medical billing, detailing the services provided during a patient's visit. This form's primary function is to capture information like diagnoses and procedures, which are then translated into standardized codes used for submitting claims to insurance companies. It is not intended for medication lists, scheduling, or demographic data collection, as those are handled by other documents. For instance, a doctor marking a procedure on this form is how the office knows what to bill. This form bridges patient care with the financial process. Question 16. When a patient cancels an appointment, what is the best practice? A. Mark the appointment as a no-show without contacting the patient. B. Immediately reschedule the patient for the next available slot. C. Document the cancellation and offer to reschedule the appointment. D. Charge a cancellation fee without inquiring about the reason. Answer. C. Document the cancellation and offer to reschedule the appointment. Handling cancellations professionally is important for patient relations and office efficiency. The keywords patient cancels and best practice guide the answer. It's essential to acknowledge the cancellation, document it properly in the scheduling system, and proactively offer to reschedule to ensure continuity of care. Automatically marking as a no-show, rescheduling without discussion, or charging a fee without proper policy or inquiry can alienate patients. For instance, if a patient calls to cancel, you'd say, "Thank you for letting us know. When would be a better time to reschedule?" This shows good customer service. Always aim to keep patients engaged with their care. Question 17. What is the role of OSHA in the healthcare setting? A. Organization for Surgical Healthcare Advancement. B. Occupational Safety and Health Administration. C. Office of Standards for Healthcare Assurance. D. Operational Systems for Health Administration. Answer B. Occupational Safety and Health Administration. OSHA, or the Occupational Safety and Health Administration, is a federal agency responsible for workplace safety. Its role in a healthcare setting is to set and enforce standards to ensure safe and healthy working conditions for employees, protecting them from hazards like infectious diseases or injuries. For example, OSHA mandates the proper use of personal protective equipment, PPE, like gloves and masks. Knowing about OSHA helps create a safer environment for everyone. Question 18. What is the primary purpose of a patient portal? A. To provide general health advice online. B. To allow patients to securely access their health information and communicate with their provider. C. To schedule social events for patients. D. To advertise the clinic's services. Answer B. To allow patients to securely access their health information and communicate with their provider. Patient portals are digital tools designed to enhance patient engagement and access to care. They offer a secure online platform where patients can view test results, request prescription refills, schedule appointments, and message their doctor, promoting better communication and self-management of health. For example, a patient might check their lab results on the portal before their next appointment. Think of it as a private online hub for your health information. Question 19. When a patient presents with a chief complaint, what is the administrative medical assistant's role? A. To diagnose the patient's condition. B. To record the chief complaint accurately and prepare the patient for the clinical staff. C. To prescribe medication for the chief complaint. D. To dismiss the patient if the complaint seems minor. Answer B. To record the chief complaint accurately and prepare the patient for the clinical staff. The chief complaint is the primary reason a patient seeks medical attention. It's essential for the administrative assistant to capture the patient's own words about why they are there and ensure they are comfortable and ready to be seen by the nurse or doctor. Diagnosing, prescribing, or dismissing are clinical responsibilities outside of this administrative role. For instance, writing down "sharp pain in my left knee" as the patient states it is recording the chief complaint. Your job is to get the initial information down and set the stage for the clinician. Question 20. What is the correct way to handle sensitive patient information when discussing it in a common area? A. Speak loudly so everyone can hear clearly. B. Use discreet language and ensure privacy. C. Discuss it briefly and hope no one overhears. D. Write down notes and leave them on the counter. Answer B. Use discreet language and ensure privacy. Protecting patient confidentiality is paramount due to HIPAA regulations. Discussing any patient's protected health information, PHI should always be done in a private setting or with discreet language to prevent unauthorized access or disclosure. Speaking loudly, using vague language without ensuring privacy, or leaving notes are all risky practices. For example, instead of saying Mr. Smith's HIV results are back, you might say, I need to speak with Mr. Smith privately about his test results. Always be mindful of who can hear you. Question 21. What is the main purpose of a patient registration form? A. To summarize previous medical treatments. B. To collect demographic and insurance information for patient identification and billing. C. To document the patient's chief complaint. D. To record vital signs. Answer B. To collect demographic and insurance information for patient identification and billing. The patient registration form is the first step in formally adding a patient to the clinic's system. This form provides essential details like name, address, contact information, date of birth, and insurance provider, which are necessary for creating accurate patient records and processing payments. A chief complaint is usually recorded later, and vital signs are taken by clinical staff. For example, filling out the form with your name, address, and insurance company details is standard procedure. This is how the clinic gets to know who you are and how to bill your care. Question 22. Which of the following is a symptom of hyperglycemia, high blood sugar? A. Sweating and clamminess. B. Increased thirst and frequent urination. C. Shaking and dizziness. D. Slow heart rate. Answer B. Increased thirst and frequent urination. This question tests basic medical knowledge related to common conditions. Hyperglycemia occurs when there's too much glucose in the blood, leading the body to try and eliminate it through increased urination, which then causes dehydration and increased thirst. Sweating, shaking, and dizziness are more commonly associated with hypoglycemia, low blood sugar. For instance, someone with very high blood sugar might feel constantly thirsty and need to use the restroom much more often than usual. Recognizing these signs is important for patient care. Question 23. What is the role of a medical administrative assistant in managing patient scheduling? A. To diagnose patient conditions during scheduling. B. To ensure efficient use of the provider's time by booking appointments accurately and managing cancellations. C. To perform physical examinations of patients. D. To prescribe medication based on patient requests. Answer B. To ensure efficient use of the provider's time by booking appointments accurately and managing cancellations. Effective scheduling is crucial for a smooth-running medical practice. The goal is to optimize the provider's schedule, prevent gaps or overbooking, and handle any changes like cancellations or reschedules professionally. Diagnosing, examining, and prescribing are clinical duties outside the scope of an administrative role. For example, ensuring a patient is booked for the correct appointment type and duration helps the provider see more patients effectively. Good scheduling keeps the clinic running on time and prevents wasted provider hours. Question 24. What is the primary purpose of verifying patient insurance eligibility? A. To determine the patient's medical history. B. To confirm that the patient's insurance is active and to understand their coverage for services. C. To schedule the patient for a specific procedure. D. To collect the patient's personal contact information. Answer B. To confirm that the patient's insurance is active and to understand their coverage for services. Insurance verification is a critical administrative task for financial operations in a medical office. This process ensures that the patient has valid insurance and helps determine what portion of the medical services will be covered by the insurer and what the patient's financial responsibility will be. It's not about medical history, scheduling, or basic contact info collection, which are separate tasks. For example, checking if a patient's insurance plan covers a specific type of physical therapy helps avoid billing surprises later. This step is vital for accurate billing. Question 25. What does the abbreviation SOB typically stand for in a medical context? A. Standby order. B. Shortness of breath. C. Son of a bishop. D. Stable on bed. Answer B. Shortness of breath. Medical abbreviations are common in charts and communication, and knowing them is important for accuracy. SOB is a widely used shorthand for shortness of breath, a common symptom that needs to be accurately recorded. The other options are either not medical terms or are incorrect interpretations. For example, if a nurse notes point care of SOB, it means the patient is complaining of difficulty breathing. It's essential to be familiar with these common medical shorthand terms. Question 26. What is a deductible in health insurance? A. The amount the insurance company pays for a service. B. The portion of the healthcare bill that the patient must pay before the insurance company starts to pay. C. The monthly premium paid for insurance coverage. D. The maximum amount a patient will pay in a year for healthcare. Answer B. The portion of the healthcare bill that the patient must pay before the insurance company starts to pay. Understanding insurance terms like deductibles is crucial for administrative staff. A deductible is the amount a policyholder is responsible for paying out of pocket for covered healthcare services before their insurance plan begins to contribute financially. The monthly premium is a separate cost, and the out-of-pocket maximum is a cap on what the patient pays. For example, if a patient has a $1,000 deductible, they pay the first $1,000 of their covered medical costs themselves. Knowing this helps explain costs to patients. Question 27. What is the purpose of a referral in a healthcare setting? A. To document a patient's vital signs. B. To provide a patient with a prescription for medication. C. To authorize a patient to see a specialist or receive a specific service not available within the primary care setting. D. To schedule a follow-up appointment with the same provider. Answer C. To authorize a patient to see a specialist or receive a specific service not available within the primary care setting. Referrals are a common part of managed healthcare systems. A referral is a recommendation from a primary care provider for a patient to consult with a specialist physician or to undergo a particular test or treatment that requires specific expertise or equipment. This often requires authorization from the insurance company. For example, if a patient has a heart condition, their primary doctor might refer them to a cardiologist. Referrals ensure patients get the right care from the right experts. Question 28. What is the meaning of the medical abbreviation DX? A. Diagnosis. B. Dextrose. C. Discharge. D. Dosage. Answer A. Diagnosis. Medical abbreviations are frequently used in patient charts and documentation. DX is a standard shorthand for diagnosis, which is the identification of the nature of an illness or other problem by examination of the symptoms. It's important for administrative staff to recognize these common abbreviations to correctly interpret patient records. Other options like dextrose, a sugar, discharge, leaving a facility, or dosage, amount of medicine, have different abbreviations. For example, a physician might write point presents with cough, DX. Bronchitis. This tells you the patient's condition was identified as bronchitis. Knowing common abbreviations saves time and prevents errors. Question 29. When a patient requests to review their medical records, what is the administrative assistant's responsibility? A. To immediately hand over all records. B. To follow the clinic's policy regarding record access, which often involves a formal request process and may require a fee. C. To refuse access to protect patient privacy. D. To provide a verbal summary of the records. Answer, B. To follow the clinic's policy regarding record access, which often involves a formal request process and may require a fee. Patients have a right to access their medical records, but there are established procedures. Administrative assistants must adhere to the clinic's specific protocols, which usually involve a written request and may include copying fees or specific timelines for access, all within the framework of HIPAA. Simply handing over records, refusing access, or giving a verbal summary may not comply with regulations. For instance, you'd provide the patient with a form to fill out to request copies of their records. Always follow office procedures to ensure legal and ethical handling of patient information. Question 30. What is the purpose of medical coding? A. To schedule patient appointments. B. To document patient vital signs. C. To translate diagnoses and procedures into universal alphanumeric codes for billing and record keeping. D. To sterilize medical equipment. Answer, C. To translate diagnoses and procedures into universal alphanumeric codes for billing and record keeping. Medical coding is a vital part of the revenue cycle in healthcare, translating diagnoses and procedures into standardized alphanumeric codes. These codes, like ICD-10 for diagnoses and CPT for procedures, are essential for submitting insurance claims, analyzing data, and maintaining consistent medical records across different systems. This process ensures accurate reimbursement and data management. For example, a specific condition like diabetes will have a universal code used by all healthcare entities. Question 31. Which of the following is an example of a vital sign? A. Patient's height. B. Patient's weight. C. Patient's pulse rate. D. Patient's eye color. Answer, C. Patient's pulse rate. Vital signs are fundamental measurements that indicate a person's basic body functions. Common vital signs include temperature, pulse rate, heart rate, respiration rate, and blood pressure. Height, weight, and eye color are important patient characteristics but are not typically classified as vital signs, which reflect immediate physiological status. For example, checking a patient's pulse to see how many times their heart beats per minute is a vital sign assessment. Vital signs give a quick snapshot of a patient's health. Question 32. What is the best way to handle a phone call from a patient who is angry or upset? A. Hang up the phone immediately. B. Argue with the patient to explain why they are wrong. C. Listen attentively, acknowledge their feelings, and try to find a solution calmly. D. Transfer the call to another department without listening. Answer, C. Listen attentively, acknowledge their feelings, and try to find a solution calmly. Customer service and de-escalation are key skills in healthcare. It's important to remain professional, let the patient express their concerns, validate their emotions, and then work towards resolving the issue. Arguing, hanging up, or transferring without context can worsen the situation. For example, saying, "I understand you're frustrated about the billing, and I want to help resolve this," can calm an upset patient. Staying calm and empathetic is the best strategy. Question 33. What is the purpose of a patient's medical record number, MRN? A. To track the patient's billing history only. B. To uniquely identify each patient within a healthcare facility. C. To assign appointments on a first-come, first-served basis. D. To store demographic information for marketing purposes. Answer B. To uniquely identify each patient within a healthcare facility. A medical record number, MRN, is a fundamental component of patient identification. Each patient is assigned a unique MRN when they first register with a healthcare system, ensuring that all their medical information, from different visits or departments, is consolidated correctly under one identity. This prevents mix-ups and ensures accurate record keeping. For example, when you check in, they scan your ID to pull up your record using your MRN. It's your unique identifier in the healthcare system. Question 34. When scheduling appointments, what does it mean to gatekeep? A. To provide the patient with the building access code. B. To control access to a specialist by requiring a referral from a primary care provider. C. To ensure all patients have a primary care physician. D. To schedule the patient for diagnostic imaging. Answer B. To control access to a specialist by requiring a referral from a primary care provider. Gatekeeping is a common practice in managed care systems. In a gatekeeping model, primary care physicians act as the first point of contact for patients and are responsible for referring them to specialists or other healthcare services when necessary, helping to manage costs and ensure appropriate care utilization. It's not about building access, primary care mandates, or specific imaging appointments. For instance, your family doctor must refer you to a dermatologist for a skin issue under this system. Gatekeeping ensures specialized care is coordinated. Question 35. What is the most appropriate way to document a patient's communication preferences, e.g., preferred method of contact? A. In a personal notebook. B. Within the patient's electronic health record, EHR, or other designated system. C. Verbally mentioned to the front desk staff. D. On a sticky note attached to the patient's chart. Answer B. Within the patient's electronic health record, EHR, or other designated system. Accurate and accessible documentation is vital for effective patient communication. Recording communication preferences in the EHR or a designated patient management system ensures that all staff can easily access and follow the patient's preferred contact method, respecting their privacy and improving communication efficiency. Storing it elsewhere, like a personal notebook or sticky note, is unprofessional and risks data loss or inconsistency. For example, if a patient prefers text messages, it should be noted in their EHR so the office can send appointment reminders via text. Always log important patient preferences officially. Question 36. What is the primary function of a medical billing specialist? A. To provide direct patient care. B. To assist surgeons during operations. C. To handle the financial aspects of healthcare, including submitting claims and processing payments. D. To conduct medical research. Answer C. To handle the financial aspects of healthcare, including submitting claims and processing payments. Medical billing specialists are crucial for the financial health of a healthcare practice. They ensure that healthcare providers are correctly reimbursed for the services they provide by accurately translating medical codes into billing statements and submitting them to insurance companies and patients. Direct patient care, surgical assistance, and research are performed by different healthcare professionals. For instance, they ensure that the codes for a patient's visit are correctly entered into the billing system to get paid. They are the financial backbone of the office. Question 37. What does the medical term stat indicate? A. The patient is stable. B. The procedure should be done immediately, without delay. C. The patient requires a follow-up appointment. D. The lab results are pending. Answer B. The procedure should be done immediately, without delay. STAT is a common medical abbreviation derived from the Latin word for immediately. When something is ordered STAT, it means it requires the highest priority and must be performed or addressed without any waiting. This is crucial for critical situations where timely intervention can significantly impact patient outcomes. For example, a STAT EKG means the electrocardiogram needs to be done right away. Always treat STAT orders with the utmost urgency. Question 38. What is the purpose of a referral management system? A. To manage patient parking assignments. B. To track and manage patient referrals to specialists and other healthcare providers. C. To oversee the clinic's janitorial services. D. To monitor physician vacation schedules. Answer B. To track and manage patient referrals to specialists and other healthcare providers. Referral management systems are designed to streamline the process of connecting patients with specialized care. These systems help administrative staff track outgoing and incoming referrals, ensuring patients receive timely appointments with specialists and that necessary documentation is exchanged between providers. This improves care coordination and prevents patients from falling through the cracks. For example, the system might alert staff when a specialist's office has received a referral and needs to schedule the patient. Effective referral management ensures continuity of care. Question 39. What is the main benefit of using a secure messaging system for patient communication within a healthcare setting? A. It allows for casual conversations between staff and patients. B. It facilitates efficient and private communication of non-urgent patient information. C. It replaces the need for in-person appointments. D. It is primarily used for marketing purposes. Answer B. It facilitates efficient and private communication of non-urgent patient information. Secure messaging offers a valuable channel for patient-provider communication. Unlike email, secure messaging systems are designed to protect patient confidentiality, making them ideal for sharing test results, asking follow-up questions, or clarifying treatment instructions without the risk of breaches. It does not replace appointments or allow casual chat. For instance, a patient can message their doctor through the portal asking about a medication side effect instead of waiting for a call back. This tool makes communication secure and convenient for routine matters. Question 40. What does the medical term BP commonly refer to? A. Blood pressure. B. Body posture. C. Best possible. D. Before practice. Answer A. Blood pressure. BP is one of the most frequently used abbreviations in healthcare. Blood pressure is a measurement of the force exerted by circulating blood against the walls of blood vessels. It's a vital sign that administrative assistants often record or see referenced in patient charts. For example, a note might say BP 120/80, indicating a normal blood pressure reading. Familiarizing yourself with these common abbreviations is essential for understanding patient information. Question 41. What is the primary goal of a patient satisfaction survey? A. To diagnose medical conditions. B. To gather feedback on the patient's experience with the healthcare services received. C. To schedule future appointments. D. To assign blame for any negative outcomes. Answer B. To gather feedback on the patient's experience with the healthcare services received. Patient satisfaction surveys are crucial for quality improvement in healthcare. These surveys help healthcare organizations understand what is working well and what needs improvement from the patient's perspective, leading to better service delivery. They are not for diagnosing, scheduling, or assigning blame. For instance, a survey might ask patients about the ease of scheduling, the friendliness of staff, and the clarity of explanations. This feedback helps the clinic improve for everyone. Question 42. What is the proper procedure for handling a patient's protected health information, PHI, when using a fax machine? A. Fax any information to any number without checking. B. Ensure the fax machine is in a secure location and verify the recipient's fax number before sending. C. Send PHI through unsecured public fax machines. D. Do not fax PHI at all, ever. Answer B. Ensure the fax machine is in a secure location and verify the recipient's fax number before sending. Faxing protected health information, PHI, requires strict adherence to security protocols to comply with HIPAA. Faxing unsecured information or to incorrect numbers can lead to breaches. Therefore, it's vital to use secure fax machines and confirm the destination before transmitting sensitive data. For example, before faxing a patient's lab results to another doctor, you double-check the fax number to make sure it's the correct office. Security is paramount when using older technologies like fax. Question 43. What is a formulary in the context of health insurance? A. A list of approved medical procedures. B. A list of prescription drugs covered by a health insurance plan, often with different tiers of cost sharing. C. A set of rules for patient conduct in a hospital. D. A plan for managing chronic diseases. Answer B. A list of prescription drugs covered by a health insurance plan, often with different tiers of cost sharing. Formularies are essential components of prescription drug benefits. Health insurance plans create formularies to outline which medications they will cover and at what cost to the patient, encouraging the use of cost-effective generic drugs or preferred brand-name drugs. It's not a list of procedures, patient conduct rules, or disease management plans. For instance, a doctor might check the formulary to see if a prescribed medication is covered by the patient's insurance before writing the prescription. Understanding formularies helps manage medication costs for patients. Question 44. What is the most common and secure method for sending patient health information electronically? A. Standard email. B. Social media platforms. C. Secure patient portals or encrypted email services. D. Text messages to personal phones. Answer C. Secure patient portals or encrypted email services. Protecting patient data during electronic transmission is critical under HIPAA. Standard email, social media, and unencrypted text messages are not considered secure for transmitting protected health information, PHI, because they can be intercepted. Secure platforms use encryption and authentication to protect data privacy. For example, a clinic sending lab results to a patient would use their secure portal rather than a standard email. Always use secure methods for digital health communication. Question 45. What does the medical abbreviation RX indicate? A. Registered nurse. B. Prescription or treatment. C. Right side. D. Routine examination. Answer B. Prescription or treatment. Rx is a widely recognized medical abbreviation. Originating from the Latin word recipe, meaning take, it signifies a medical prescription for medication or a broader treatment plan. It's a fundamental term that administrative assistants encounter frequently when dealing with patient orders and documentation. For example, a doctor writing Rx. Amoxicillin 500 mg TID means they are prescribing amoxicillin to be taken 3 times a day. Knowing Rx signifies a medication order is key. Question 46. What is the purpose of a prior authorization in healthcare? A. To approve a patient's appointment time. B. To obtain approval from an insurance company before a specific medical service or prescription is provided. C. To document a patient's medical history. D. To schedule follow-up procedures. Answer B. To obtain approval from an insurance company before a specific medical service or prescription is provided. Prior authorization, also known as pre-authorization or pre-certification, is a process required by many insurance companies. It ensures that the insurance company agrees to cover a particular treatment, procedure, or medication before it is administered, helping to control costs and ensure medical necessity. It is not about appointment times, history, or scheduling. For example, if a patient needs an MRI, the clinic must get prior authorization from their insurance before the scan can be performed. This step is vital for billing and patient coverage. Question 47. When documenting a patient's vital signs, what is the standard unit for temperature? A. Fahrenheit or Celsius. B. Kilograms. C. Inches. D. Millimeters of mercury. Answer A. Fahrenheit or Celsius. Accurate documentation requires using the correct units of measurement. Both Fahrenheit, degree F, and Celsius, degree C, are widely accepted scales for measuring body temperature, and healthcare settings typically use one or both. Kilograms are for weight, inches for height, and millimeters of mercury for blood pressure. For instance, a normal oral temperature might be recorded as 98.6 degree F or 37 degrees Celsius. Always use the unit specified by your facility. Question 48. What is the role of a medical administrative assistant in managing patient correspondence, such as appointment reminders or test result notifications? A. To diagnose any patient conditions mentioned in the correspondence. B. To ensure correspondence is sent accurately, securely, and in a timely manner, often utilizing the EHR. C. To dictate the content of all patient communications. D. To personally deliver all patient correspondence. Answer B. To ensure correspondence is sent accurately, securely, and in a timely manner, often utilizing the EHR. Effective communication with patients is a key administrative function. This involves preparing, sending, and tracking various forms of communication, ensuring privacy and accuracy, often through the electronic health record (EHR) system. Diagnosing conditions, dictating content, or personal delivery are generally not part of this administrative task. For example, sending a reminder about an upcoming appointment via the patient portal is a common administrative duty. Timely and secure communication builds patient trust. Question 49. What is the primary purpose of a superbill or encounter form? A. To record patient allergies. B. To provide a detailed summary of services rendered for billing and insurance purposes. C. To track patient attendance at appointments. D. To document physician's notes from a patient encounter. Answer B. To provide a detailed summary of services rendered for billing and insurance purposes. The superbill or encounter form is a critical document in a medical office for financial operations, detailing the specific services provided during a patient visit. This form is used to generate bills and process insurance claims by listing diagnoses, procedures, and associated charges. It is not used for recording allergies, tracking attendance, or storing physician's notes directly. For instance, after a patient sees the doctor, the superbill lists the exam, any tests done, and the associated costs, which are essential for getting paid. Question 50. What is the significance of the patient's insurance network when scheduling appointments? A. It determines the patient's preferred appointment time. B. It affects which providers the patient can see and how much they will pay for services. C. It indicates the patient's medical history. D. It is only relevant for prescription refills. Answer B. It affects which providers the patient can see and how much they will pay for services. A patient's insurance network is a critical factor in scheduling and financial matters. Understanding a patient's network helps ensure they are scheduled with in-network providers to maximize their benefits and minimize out-of-pocket costs. It doesn't dictate appointment times, medical history, or prescription refills directly. For instance, if a patient's insurance only covers services at ABC Hospital, you need to schedule them there, not XYZ Clinic. Knowing a patient's network is crucial for efficient and cost-effective care coordination.